organizing this program. And even though I had a very hectic schedule, actually today I got up at 4 o'clock and I landed here by 6 o'clock and immediately went to a South Media Summit. And then yesterday also I travelled from Puducherry almost 3 hours to reach Chennai. And then I came here. Particularly, I am very happy that such programs are organized in Raj Bhavan. So Raj Bhavan, as I said, it's more productive and more protective also. So I want to not only physically but medically and mentally also, particularly to serve the people of Telangana. And I am really very happy that, as Madam Santakumari said, almost we thought, oh, gynecologists, we are only confined and we are only the sole proprietors of the womenhood. And you have more and more role to play and more responsibility. And I am really very happy it is focused in a very precise manner about womenhood. And all the awareness, everyone was telling about awareness. And most of the people are focusing on the uterus and ovaries, and most of them they forget women also have brain, women also have heart, women also have kidneys, and women also have gastrointestinal tract, and women also have some piece of should have piece of mind. So nothing is focused. So childbirth and gynecological problem, and the child, when she is bearing the child, the whole family will be appreciating her and lauding her, protecting her. One child is born, okay, next she has to go for her work, whether it is physical work or home work or official work, something. So I'm really happy that policy decision committee has focused particularly on women. And it is need of God, and we have been talking for 75 years about women. But yet we have not come to a conclusion, and they have yet as it is said, 80 beds are for men and 20 beds for women. And I very clearly said, I read one statistics. Actually, one of the conferences, because I was working as a pediatrician also, as gynecologist also, and sonologist also, and a social person also. So I used to attend gynecology conference also, pediatric conference also, and sonology conference also. In one of the pediatric conferences, they projected girl children are more resistant, and have more immune power. And the statistics projected was the under 5 OP, outpatient department. They projected more male children were brought to the OP. So female children are very healthy under 5 and they are more immune and like that. Then we told this, we asked about the statistics and everything. They concluded like that. But one of the social person, this happened when I was a postgraduate in gynecology. One of the social person stood up and vehemently opposed that statistics, and she told, girl children are not brought to the OP. In spite of the suffering, male children, if they have minor ailment, immediately they are brought to the OP. The girl children are not brought to the OP. So when they are not brought to the OP, how will you have statistics? So that is the main thing. So from the childhood, and I always narrate on, as a sonologist 30 years back and all, we can disclose the sex of the baby. And the patients will come and ask not sonologist mission, Anapanna Pakara mission. So that whether it's male or female, identifying mission only, they will tell like that. And when the girl child is born, immediately girl child is identified, the mother will cry and mother-in-law will scold her. And you told there are no strict laws, but strict mother-in-laws are there, strict daughters are there. So it is very difficult to face them. Then after this and after delivery also, I had a very pathetic case during my house urgency. We had twin babies born, 2.5 kg. And one was, twins means regular monitoring is needed. Then one was gaining, female was losing the weight, male was gaining the weight. And then we did all the investigations were normal. But at the same time, we were inquiring people or feeding feeding when they are crying, we are feeding like that. Suddenly I thought that you are she was a very emaciated, very undernourished village mother. So we asked whether you have adequate breast milk. Then she told, my mother-in-law asked to give my whole breast milk to the female, and the female we are giving diluted cow's milk. So this was the pathetic tension. I cannot say the situation has totally not there even in the villages now. So another thing. So the womenhood, whether it's tip of the iceberg, what is the development, I always think that we have so much of poster and governors are females, and even president is female, but downtrodden, the development is tip of the iceberg. So only we and nutrition. Nutrition part, first of all, whether we concentrate on disease or not, because good nutrition can prevent what all the symptoms and what all the diseases. So basic foundation is nutrition. Personally in Telangana, when we went to the tribal areas, we have adopted 6 tribal villages. And when we, with the help of the ESIC hospital and National Institute of Nutrition, we did medical camps, and we found the tribal women had only 4 grams of hemoglobin. And then we told them to take medicines, but they refused. As it is said, some of the traditional method. Then we founded Mehua flowers, which they take for addiction. And we did, with the help of Institute of Nutrition and ESIC and even Red Cross, made laddus with the Mehua flowers. And now we have given that, Bhavan is pending, and we have given that, and now the nutrition status of the women are improved. So it is 6 villages we have shown the improvement, and we want it to be implemented in other areas also. So, but after that, actually we know the premature deaths, young mothers, they die, maternal mortality is more among. So after adopting this method, we visually see improvement in the livelihood. So this is one. So and another thing, most of the governments give the nutrition kits to the mother in the 3rd month, 6th month, or during last trimester. You all know preconceptional stage is the most important, and that is not, patients are not concentrated on that period. Only after pregnancy, after diagnosis, and nutrition is needed, but it is not needed as such in the preconception. So the government policy should be in the preconceptional stage. So another thing, adolescent stage. Adolescent girls are mostly ignored, and I always say in schools also, don't treat the male children of that age female children, because male children doesn't have much of the physical problems, bodily problems, but girl children, they have age menstruation and premenstrual tension, they have premenstrual depression, they have. So don't treat the girl children the same as the male children. So adolescent age. So from the birth we have to concentrate on the women, but particularly adolescent. And traditionally we are losing certain things. Corona integrated medicine, I am really very happy, because I am a person, even though I am an allopathic doctor, I strongly believe in the integrated medical system and preventive system also. I really laud our Honorable Prime Minister about the Yoga Day, because yoga gives answer to so many things, particularly obesity. Most of the things, the basic problem is due to nutritional factors and the obesity. As the bariatric surgeon told, it is overnutrition. And awareness, because one of the friend told about the vegetables, local vegetables, but we had a practice of sowing seeds in the house and taking it every day once. A problem in our family is, when it is cheaper, they don't think. If a boy comes and asks the family, I don't want dowry and I will marry your girl, then they will tell, no, they won't be happy. Oh, this boy is having some problem. So he is coming in forward to marry the same manner. Give some nutrition, because greens are very less, and you needn't go and buy, even kitchen gardens we can have. So these type of traditional activities also to be, and even in the, I don't know whether that practice is here, when a girl attends menarche, now we think it's a fashion to hide it. But in the villages, they are very proud that child has attended menarche, and they used to give this green gram, black gram laddus, and they used to give raw eggs, and they used to give the sesame oil. So these all strengthening the calcium content, anemic content, and strengthening their bones. So immediately when it is needed, our ancestors, really I used to laud them, because as we know the nutritional aspect of those things. So exactly during the menarche, they were giving it, and mental also, because they had some program. They used to tell, no, why to propagate? It's not to propagate. Other children will come. So this is one of the phase we have to pass in our life. We have to face in our life. So they had a knowledge about it. But now, even though they have the wrong knowledge, they go to internet and they browse for different things, the correct message is not gone to them. So this type of education is more needed. So first of all, first and foremost, nutrition we have to. And another thing, as somebody told, pharmaceutical, I have seen. When I was house surgeon at Tanjavur Medical College, it's a peripheral hospital. We used to give iron tablets. When we go for lunch at the backyard, we used to see the iron tablets thrown in the ground, saying that it's black in color. So if we take it, our baby also will be black in color. But in a lighter sense, I also know we are all black in color only, we have become doctors. And in a lighter sense, I used to appeal the pharmaceuticals. Please produce iron tablets, multicolor iron tablets. Because like saris, women like multicolors. So even these are subtle things. We think that we have given iron. So we have to introspect, even though the plan is there. Even, for example, somebody told about the sanitary napkins. In Jannosheds, for 1 rupee we are getting the sanitary napkins. Even we are not aware of our disease, and we are not aware of our government schemes also. And even nutrition. In Jannosheds shops, the nutritional protein powder, the anemic tablets are all much cheaper. For example, if it is 1 rupee outside, it is only 10 paise. And even government hospitals are providing. Yeah. So these things should be, we have to learn about that. The insurance scheme also, Ayushman gives for more treatment before and all. Cesareans were not included, women diseases were not included, now it is included. So, according to National Health Mission, somebody told about Universal Health Mission. We have National Health Mission. So, National Health Mission, every woman should be screened, every woman should be screened for cancer, every woman should be, but it is not implemented the way it should be implemented. Lack of awareness, because we conducted the health initiative allocations in the union budget also. But most of the people are not aware. Because National Health Mission, we have everything. Particularly women, they have to focus. And nephrologists told about dialysis. And in Puducherry, we are going to adopt the Gujarat model of dialysis, where they have 100% they are reached. Other areas, for example, dialysis is needed for 5 hours. Poor patients will have dialysis for 2 hours, and they will pay for 5 hours, and they will pay. So, but our Prime Minister's dialysis scheme is there. But patients are very hesitant to go to the government hospitals, because it is our mistake that we have not given hope that government hospitals also can give good treatment. So they are spending their money in the dialysis. 2 or 3 months they will go, which is needed eternally till the transplantation. They don't know that, and they die of renal disease. So these all things. So first of all, according to me, we can women, as it is said, ophthalmologist 90%, but gastroenterologists, they need colonoscopy and other things. Means according to our tradition, it is very even gynecologists, because even pelvic examination, they will be in the village people, they will be so hesitant to do, and then we convince them. And I very appreciate about the pyramids we have created. Some thought, no, we have everything. I think we have to reorganize certain things, that's all. For example, 1 hour. Women, in Puducherry we are giving 1 hour concession for working women. It is just recently introduced, and it is given in a good intention. But the opposition parties told, some of the opposition parties told, you are again making women empowerment is tarnished. You ask them to work in the house for more than 1 hour. And we are not like that. We wanted her to relax. We wanted her to work out because she can work out when her husband has gone and children has gone to the. Otherwise, she will be confined to the family work. So that is also given. So small changes. For example, another thing which you are all talking about relaxation. Yesterday we have introduced a no bag day. Children were so happy and they came with because that relaxation. Last month day is known as a bagless day because whole month they are carrying. So yesterday I was also playing with them. And so they were immediately when I entered, thank you madam for not bringing the bag, something they were telling. So that relaxation, whatever, whether it is children, whether it is ladies, even men, because when ladies are relaxed, men will be definitely can be relaxed. When they are tense, I always say it's not just in lighter sense. Females make it maybe good administrators because they can manage men, but men cannot manage all women. It is very, very difficult. So when women are happy, the whole society is happy and the whole family is happy. So we have policies, and I really, as Ms. Karna Gopal told, Honorable Prime Minister focuses on health more. So only he brought Ayushman Bharat, and he had stents and all, 40% reduction in this stent before and all. Stent means it is only for very rich people, even the auto drivers, our brothers, working in a very simple manner. Also, they are also getting it in knee replacement. Women for women, and this exposure to sun, this and all we have to, we have lifestyle changes, and also only our Honorable Prime Minister is done so slightest change in anything, so that it will have a very good effect on your, So I am really very happy, but my request is, in each speciality, what can be done for women? Now you are getting their reports, and awareness should be created not only by doctors, by social persons, and it should start from the school level, and it should start from the college level. And I had an anemia-free society program among the college students. So as a gynecologist, I used to go for interaction. If the child is having over menstruation, the child won't ask she is suffering from. She will tell us, my friend is having 7 days period, my friend is having 10 days, she won't. So there was an outlet, there was a guidance for her. Most of the children, I have to, very painfully, I have to narrate one incident. One child from Madurai, when I was when I was postgraduate in gynecology, she was putting on weight. Mother was scolding, you have to get married, why are you putting on weight? And she was going to gym, and she was going to the beautician, and I have to say the cosmetologist, there are very, very thin balance between the cosmetologist and the dermatologist and the beauticians. So most of them go there and get creams, and there won't be a permanent solution. This child was, the whole family was scolding her, and she was exercising, not taking any food, and she was suffering from ovarian cancer. When she was brought to for scan, I was only doing scan, and it was in a very grade 4 stage. It would have been, because immediately obesity means then another thing, we have whatever the girl child says, immediately it is not getting the attention. And even if she is sexually harassed and if she has some problem, you should be proper. Why are you going there? So we have to be very careful in handling. I always say, you have to handle the girl children with like a glass. Should not too tight, it may break, or if too loose also it will go fall down and break. So these are things. So as a doctor, also as a social person, first nutrition. adolescent nutrition, girl child nutrition, preconception and nutrition. Menopause is a very important topic. Nobody is concentrating. Why mother-in-laws are irritated? Because mother-in-laws are in the menopause stage. So only our customers say, no, you get the blessing of her, you fall on her foot and then get it. So it is mentally making them, okay, we are also taken care. So these type of our traditional things which were taking care of the mothers and grandmothers also should be taught. So we have to back to roots, because Corona taught us as its integrated method, and I am very happy that I am a strong believer of Indian medicine. So even though if thank God, because I'm traveling this and all, because I integratedly I take that immune pepper and this and all, I take more. And first of all, whatever may be this thing, and another thing, whatever may be the scheme, should be enforced in a proper way and ensured that it is taken by the children. For example, we are introducing millet laddus in Puducherry next week. Millet laddus are given to the children. So such things, when it is given in the schools, burfis can be given. Coconut burfis are more nutritious. So children nutrition can be taken in that way. And preconceptional stage itself, mothers during marriage itself, and this vaccine, Indian vaccine to prevent cervical cancer, that should be propagated. And one thing is that women's health should be the primary factor for everyone. And school also, continuous education should be there. 1 hour in a month or 1 hour in every 15 days. Health education for girl children should be there. Particularly in the adolescent age, they are unaware of the bodily changes, and mothers are not very competent to explain it. When it is taken in the school level, it will be very good for the children. Second, awareness about the hygiene. And Swachh Bharat, as you said, most of the dropout girl children, they experienced dropout because there were no toilets. So toilets are very important, and even developed states also lack in good toilets. So we have to concentrate on that. So then coming to the neurology, nephrology, cardiology problem, first her mental well-being, her physical well-being, and somebody told about gym in her. So they should make serial. When you see the serial, you walk. Don't try only. you try walking and then do some yoga. So because everywhere we cannot give equipment, so that awareness also, don't going on sitting and seeing. Constantly, because now IT people, we are telling, no, you sit and then between you close your eyes for some time, and then and another thing to be concentrated is IT female professionals. All problems poor girls are facing: delayed marriage, PCOS, obesity, and lack of nutrition. And there was a study in Telangana, fertility problem also. There was a study in Telangana, one of the NGO organization went and opened the tiffin box of each and every child. That happened in Telangana. And 90% of the tiffin boxes had burgers, breads, chips. No traditional food at all. So this awareness should be created among the women. Please do some idlis. Idli, dosa, at least each and every day you have to put dosa. And some idlis or some pongal with all legumes, everything can be done. So cooking awareness with nutritional aspect, because obesity is more, because children, they are given 10 rupees, okay, you get something. So they are getting something and they are eating that what they are. I always say, we are calculating our currencies, but we are not calculating our calories. So that is very important. So from the beginning, calorie maintenance and physical activity, nutrition, that will curtail most of the disease. First phase. Second phase, What all the problems, for example, neurological problem, gynecological, endocrinological, what all the problems sorted out, and it should be concentrated in the medical checkup. Mostly our medical checkup confined to gynecological, everything should be included in that. And female ICUs, female wards a little more in number, and mobile clinics for females. Mobile, because they won't come, they can't come. And mobile health checkups for women, particularly rural women. And we have to concentrate, because apparently we can say every ration card, every Aadhar card, we can have a data. And we have to concentrate. If a village is there, it is not the 10 village person, 100 village person. Every person should. In National Health Mission, we are doing that. I don't know whether states are doing that. Because I am directly in the administration, I am telling about Puducherry. And all these things, if it is done, definitely women will be very happy. And instead of some sanitary package, because Red Cross gives a package like that, sanitary pads, some disinfectants, some solution, some towels, like that. So if we want to gift a child, girl child, we can gift them with such activity, such this thing. So from the school level, we have to, this is more hygiene and nutrition. First we have to, in a phased manner we can go. And I appreciate all the specialists who concentrated on, as it is said, more incidences are there. And even they think heart attack also they won't affect, because after menopause we know the incidence in women are more than men. But another thing, families are not allotting money for the family health checkup. The budget, first thing cut in the budget is women health. And women also, we have to, I always narrate one incident when we were house surgeons, postgraduates. There will be one exhibition that I have already narrated in some of the conferences. The sari shop will be there, jewellery shop will be there, cosmetic shop will be there. So we pleaded our head to HOD so that we all postgraduates collected money. I always, in social perception, it's not only after I became the governor, I from my postgraduate days itself I had a very social outlook, so something should be done. So we collected money and we hired a stall and we had charts and all for how breast cancer will be diagnosed, and but then we had a pap smear and we had a mobile mammogram, everything we had. And we had we wore our coat and with stethoscope, we were all sitting, these ladies used to come, first they enter the sari shop, then we will be very eager to, they will be entering, very fast they will cross us, then they will go to the jewellery shop. So they are not also interested in, so they think that nothing will, so women also should have, then they will tell, even for a husband, if they are stomach pain, gastroenterologist should see, should consult, and if my child is having headache, they will consult a neurologist. But if they are in the kitchen, they will go, they will take some asafoetida, some pepper, and they think they are sacrificing. That sacrifice, it is not good for the family also. So first of all, awareness, and then happiness, and yoga practice, and institutions and mothers should be taken care. I always, whenever I talk about yoga, I used to talk about women's sari yoga. So traditionally they immediately they told, no, I don't have the yoga dress, so I won't. So naturally with the life pattern, for women something should be taught. Otherwise, if you want them to take away from the family pattern and traditional pattern, they won't. So go with them, along with them, collide with that, and then we have to. So these are things, because you all have done, did very good, but added points only I am telling, because they have covered very well. Even though we gave 2 minutes, I really appreciate you, they have done very well.
And most important is actually when, especially during election time, when people come and ask for, we tell them to ask them to do health care.
Yes. TB Mukt Bharat by 2025, Honorable Prime Minister wants India to be TB Mukt. And the Nikshay portal, actually Rajbhavan has adopted 100 patients. That government schemes, if we align with them, it is very easy, but we are not doing that. So that was what all the sickle cell anemia free